Hey everyone, and welcome to a new episode of He's Not Wrong. I'm your host, Chad D, and the episode that I have for you today, it's deep, it's important, it's a conversation that I believe wholeheartedly everyone needs to be having. Because listen, Black women in America are dying in childbirth at 3 to 4 times the rate of white women. And that number is devastating, but there's a number beneath that that should make all of us just like stop in our tracks and think for a second about what is actually happening in this country. Because Black women with college degrees are 5.2 times more likely to die from a pregnancy-related cause than a white woman with the same degree. And that gap does not close when Black women have money. It doesn't close when they have education or status or excellent health insurance. And more than 80% of those deaths are considered preventable. 80% of deaths are considered preventable in a country that calls itself the greatest in the world, and yet we are doing nothing to close that gap. I live in Alabama, all of you know that by now, but we have the third worst maternal mortality rate in the country. Black women in the state are dying at an estimated rate of 100 per 100,000 live births. 55 of our 67 counties are rural. Entire counties in the Black Belt have no OBGYN, no birth center, no midwife. Women are driving over an hour in active labor just to reach a hospital, and when they get there, that hospital may not have what it takes to keep them alive if something goes wrong. My guest today has spent years trying to understand exactly why this keeps happening and who keeps letting it happen. She's a law professor at UC Berkeley, a medical anthropologist, and the author of a book that I believe is one of the most important things written about race and health in this country in years. It's called Expecting Inequity. And it is the product of several years embedded inside of one of San Francisco's most prestigious hospital systems, with more than 200 interviews with pregnant Black women and their providers, and a career's worth of research asking the question that this country refuses to answer honestly. If we know Black women are dying, and we know why, and we know that it's preventable, then what exactly are we choosing when we keep letting it happen? You may also remember today's guest from her viral Senate Judiciary Committee hearing back in 2022 when she was fighting for marginalized groups, pushing back against dangerous rhetoric from Senator Josh Hawley. Here's a clip.
You've referred to people with a capacity for pregnancy. Would that be women?
Many women, cis women, have the capacity for pregnancy. Many cis women do not have the capacity for pregnancy. There are also trans men who are capable of pregnancy, as well as non-binary people who are capable of pregnancy.
So this isn't really a women's rights issue.
We can recognize that this impacts women while also recognizing that it impacts other groups. Those things are not mutually exclusive, Senator Hawley.
Oh, so your view is that the core of this right then is about what?
So I want to recognize that your line of questioning is transphobic, and it opens up trans people to violence.
So it is without further ado that I give you today's guest, Khiara Bridges. Welcome to He's Not Wrong, Khiara Bridges. Welcome, welcome, welcome. I'm so happy that you are here. How are you doing?
I'm great, and thank you so much for having me on the show. I'm excited to talk to you about all the things.
Absolutely. Listen, I was introduced to you, I believe it was last year, when you were in a Senate hearing. And
it was actually, you know what? It was 2022.
It was 2022?
It was many years ago at this point. But whenever it pops up on social media, it looks like it happened like literally yesterday.
Well, listen, that's even better because you quite literally showed so much grace and poise and knowledge in taking down Senator Josh Hawley. Anytime that we can do something like that to Senator Josh Hawley, I am so appreciative of. I bow down to what you did. My listeners have heard a clip of that before we got to this conversation. I mean, that was a masterclass in how to disarm, I think, some really just bigoted and unintelligent attacks on minority communities. You said 2022, but I mean, it could have been yesterday because
it could have been yesterday. Yes.
Yeah, your response to what he was saying, it's almost like it's evergreen with how our politics are going.
Right. I mean, so, the response was not so much to the questions that Senator Hawley had posed to me. The response was to the assumptions behind the questions. And also, in 2022, but certainly in 2026, it's hard to not be aware of the fact that the GOP has made trans people into a boogeyman,
Yeah.
into villains in order to win elections. And so that hearing came on the heels of Justice now Ketanji Brown Jackson's confirmation hearing, in which she had to field ridiculous questions, one of which being, define
Yeah.
woman.
Yep.
So I was well aware of that confirmation hearing going into the congressional hearing that I did. And I actually, when I watched Justice Ketanji Brown Jackson respond to these questions, I knew that she couldn't be as candid as she probably would have liked to be because
Yeah.
she needed the votes. I didn't need any votes. So I felt like I could defend trans people in a way that Justice Jackson could not. And so I took an opportunity to do just that.
I appreciate you doing just that. Like I said, it was a master class, and it is even more relevant today than I feel like it was in 2022. We can learn a lot from your words and how, like I said, you disarmed Senator Josh Hawley and the attacks that he was making. I live in Alabama, and a lot of what we have going on right now with Republicans in this state with their political ads, they're based in nothing. They're coming after Muslims and
Yep.
the Islamic community. That community is 0.5% of our population, and almost the majority of all their ads are focused on the Islamic community. It makes no sense. We have one candidate running for attorney general,
Mhm.
and she's talking about how she's going to ban trans women from playing in female sports, and it's like Kay Ivey already banned that in 2021, and then in 2023 she expanded it to college athletics. And so even though
Right.
it is not an issue in the state, they're trying to make these things issues when they're not.
Absolutely. I mean, and I mean, I don't think it's a secret that the reason they're making trans people into an issue and they're making Muslims into an issue is because what they're actually seeking to accomplish once in office is will not benefit the majority of the electorate.
Yeah.
So they are running on these platforms where it's like classic culture war type of thing,
Yeah.
right? So you run on this platform where you have incited this controversy that's not really controversial. I mean, as you've mentioned, the number of trans women playing sports is a fraction of a percentage.
Hmm.
There is no danger that Sharia law will become the law of the United States anytime soon. Nevertheless, you hear conservative politicians talk about the threat that Sharia law poses to the United States and how it might be used to denigrate our own constitution. And these are just not real issues. But what
Yeah.
it does do is distract from the things that are real issues. And they get elected off of fear tactics, and then they do what we have been witnessing for the past 2 years at this point, or actually it's been only been a year and a half. It feels like forever,
Yeah.
where we have the dismantling of the administrative state. We have a war now going on. It's what, second month at this point.
Yeah.
So we have all of these things that are really harmful to the vast majority of the electorate. And they're not running on that. They're running on, boogeymen, trans
Yeah.
people and Muslim people.
I've been telling a lot of people, if you want to know what your Republican candidates think about, you just watch their ad.
Yeah.
Remember when they
Yes.
yeah, they don't think you can think for yourself, that your issues don't matter to them. Just watch their ads. It tells you everything you need to know. When
Yeah.
you were in that Senate hearing and it ended and you walked out of there, did you know what you did in that moment? Were you aware that you quite literally just you paved such laid a beautiful foundation for people to grasp onto, to be able to push back on the things that he was mentioning in his line of
I,
questions?
I did not know. Like I just had no idea how big it would become. I it was my mother's birthday that day. It was her 70th birthday that day. And I had brought her to the hearing because I was like, oh, Mom, this is going to be really, it might be boring, but at least, it'll be memorable. And so my mom was there with me. And, my mom is one of the most audacious women walking this planet. She's the reason why I have the confidence that I have and the audacity that I have. And I sort of felt her energy behind me, like that throughout the entire hearing, and certainly during that exchange. It's because of her strength that I had the strength that I have just generally. So yeah, after the hearing, my mom and I walked out, and we're in DC, and I'm like, let's grab some lunch somewhere, and we're walking to like a deli, and I look at my phone, and one of my best friends in the world, who I hadn't even mentioned that I was in DC and going to be doing this congressional hearing, he had texted me, and he was like, "Girl, you are trending on Twitter." And I was like, "What?" And so, it became this, huge, huge, huge thing. And it got a lot of attention just from like all corners of the internet. But I'm really proud of the work that I did that day
Yeah.
because the messages that I received from trans people themselves, and probably more so from parents of trans kids, just thanking me for
Yeah.
defending their children. And we're talking about, comfort and the ability to move through the world in the way that you need to move through the world, but also we're talking about life and death here. We're
Hmm.
talking about being able to access the healthcare that you need, being to be seen and to be affirmed in a way that would make life worth living. And so I've just received just so much affirmation and gratitude for what really was just like a minute and a half. And I was, I'm proud I'm actually just really glad that I had an opportunity to stand up for trans and non-binary people, because I mean, it's sad that they even need people to defend
Yeah.
them, but we are certainly in a socio-political moment where defense is necessary for that community.
Like you said, it's life or death. And you never know, even in that minute and a half, the impact that you've made on someone. And you could have quite literally, and I know you did, so I'm not even going to say you could have, you did save lives that day with your
Mhm.
advocacy in that minute and a half. And I think what we saw come from you, from your character, from who you are as a person in that hearing, um, it's a perfect representation for the kind of fight that you put up with the work that you do outside of that hearing that you've done in the years since, and for the years well before that hearing as well. You just released a new book called Expecting Inequity, and you are fighting for Black women and their health care. Black women have, I believe the stat is they're 3 times more likely to die in childbirth than a white woman. In America's maternal mortality rate, it's abysmal
Right.
for a country that is so advanced in economics and in healthcare, and yet this one population is suffering. For why? It makes no sense. And
Right.
so your entire book is built on what happens underneath that statistic. So I just
Right.
want you to walk me through what you found with that.
Yeah, sure. So you're absolutely right that the US, its maternal mortality ratio is abysmal. Like we should be embarrassed as a general matter.
Yeah.
We are one of only a few countries that is experiencing an increase in the maternal mortality rates. Most countries around the world have managed to reduce their rates of maternal deaths over the years, and the US is one of only 7 at this point, where our maternal mortality rates are increasing. Moreover, it is the wealthiest of all the nations in which the maternal mortality ratio is increasing. So it's not a function of us not having the money to solve this problem. It's not a function of us not having the knowledge even to solve this problem. Rather, it's a function of a lack of political will to solve this problem. So as in the book, I explain that giving birth in the United States is actually a dicey proposition for anybody of any race. When it comes to white people in the United States, it is safer for them to give birth in all of Europe, in Canada, in Australia, and New Zealand, right? So all of the high income countries, white people in the United States would be better off going elsewhere. So we're failing pretty much everybody in the United States when it comes to maternal health care. But we are desperately failing Black people. And as you've already mentioned, Black folks are 3 times more likely than their white counterparts to die from a pregnancy-related cause. So this is during pregnancy, during childbirth, or during the postpartum period. And what I discovered when I was researching the book, or actually like the engine, like the reason that I wanted to write this particular book, was that statistic kind of hides the fact that even wealthier Black people are vulnerable to preventable death. So the statistic is that Black people die 3 to 4 times more often than their white counterparts. But that racial disparity persists across income levels. It's not a function of Black people disproportionately bearing the burdens of poverty in the US, which we certainly do, but it's actually a function of racism, because even when one has all the class privilege in the world, even when one is high income and one has, a JD or an MD or a PhD, a degree from an elite institution, even when one has a high status job, we're still more likely to die than our white counterparts of similar class privilege. And in fact, the disparity increases as you move up the socioeconomic ladder. So the rates at which poor Black people and poor white people die is actually closer than the rates at which wealthier Black people and wealthier white people die. So there's something about our healthcare delivery system and something about our just country generally that exposes you to a unique kind of vulnerability when you move to the higher ends of the socioeconomic ladder. And so it's kind of like a puzzle that I dedicated 2 years to research and then another 2 years to write it up. And so now we have Expecting Inequity in the World.
When you're okay, we're going to get into this a little bit later in my run of show and my questions, but does that have to do with like the public healthcare system and Medicaid and the private hospital? Okay.
It does. And, so my first book, Reproducing Race, which is very much an academic book. So I'll just say that Expecting Inequity, I wrote it for, non-academics. I wrote it for my mother. I wrote it for,
Sure.
my uncle. And so it's accessibly written. But my first book, Reproducing Race, was very much an academic study. But I looked at lower income people. I looked at Medicaid specifically, and I looked at public hospitals where low income people receive prenatal care. And I was really, really, really critical of those spaces because they denied people's humanity. They denied their autonomy and their agency and their capacity to make decisions around their healthcare. And so I was highly, highly critical of those spaces. But it turns out that highly regulated environment, that sort of will to deny autonomy and decision-making authority, that actually is protective against the physician discretion that leads to different healthcare being provided to differently raised people. And that leads to this higher disparity between Black and white people at the higher ends of the socioeconomic ladder. So there's a puzzle there, right? This thing that is highly critical, which we should criticize. Like, we absolutely should criticize the fact that Medicaid provides healthcare in a way that is, I don't know, it's chaotic.
Yes,
and
yeah.
But that apparatus ends up being it ends up equalizing the outcomes between Black and white people. So, like, what should racial justice look like then?
Yes. And I'm from Montgomery, Alabama originally. And I talked about this in a previous episode with one of President Obama's advisors last year. But it bears repeating that when you look at public services and public infrastructure, there's a reason why it's being offered. And when you privatize things, you're often allowing for that racism, for hatred, for all of that to go under the radar and to be normalized and allowed. So in Montgomery, when you look at the civil rights movement, when you look at our system of education, a lot of the private schools that popped up in Montgomery came about in the 1950s. They were in direct opposition. They were a protest of integration. And because of that, ever since then, the Montgomery public school system has been failing and it's never been able to recover. And so now, I mean, unless you're in the magnet program in a place like Montgomery, most times families go without because they're having to pay exorbitant costs to send their kids to private school just to have a chance at higher education. And that's because they privatized education and that became normal. And there's just so many through lines with what you're saying that I can point to other areas where it's the same playbook.
Right. Absolutely. Absolutely. And, and so while these private, so, when it comes to healthcare, the private market, of commercial health insurance, there are certain, of course, benefits to it because the care tends to be more, I don't know. It just has like the bells and whistles,
Yeah.
the things that make things luxurious, and that people like, that signals their high status, but that might not necessarily be what is best for people, because the public space, although it might be under-resourced, although it might be underfunded, although it might be overburdened, if it is in fact oriented towards anti-racist ends, if it's actually oriented towards serving the most marginalized, well, then like those who are marginalized might be better off in that underfunded, understaffed, overburdened space. So we've created like this really just this complex problem that nevertheless we could solve if we sort of release our attachment to thinking that the market, and private markets particularly, will solve all of our problems in the United States.
One of the women that you write about in your book, her name's Annette,
Yeah.
and she was highly educated. She had a law degree. She was a civil rights attorney. Like on paper, she was a person of color. On paper, she's the type of person that you would think would benefit from the healthcare system, the private healthcare system that we talk about. That is she's an ideal candidate for a private hospital. But that's not what her story was. Can you tell us a little bit about her story?
Yeah, no, this like as you were mentioning, like Annette did everything right.
Yeah.
She was married. She had a JD. Is a civil rights attorney, right? She was doing all the things that, one is supposed to do in order to get the care that, one needs. But during her pregnancy, towards the end of her second trimester, she started experiencing a racing heart. And she would go to the ER whenever her heart started beating incredibly fast. And the ER was like, oh, you're just stressed out. This is, you're stressed because of your pregnancy. Don't worry about it. What you need to do is relax. So that started happening towards the tail end of her second trimester. Also, during her pregnancy, she started experiencing these like, to call it like nausea or pain, just it just misdescribes the severity of the pain that she was experiencing. I would ask her, I was like, on a scale of 1 to 10, how bad was this pain? And she was like 25, 30. Like it caused her to vomit. It caused her to become incontinent. She would, writhe around on the floor in agony. And of course, she would go to the ER when she was in this type of pain. And the ER dismissed her. When she would follow up with her midwives, they were like, "Oh, it's because this is back pain. You should buy a bra that's more supportive of your breasts." So it turns out that the racing heart was caused from a pregnancy-induced heart condition that was potentially fatal.
Oh my
And
God.
that was diagnosed when she was in labor. Because she was in labor, she was in the hospital. They decided, let's run an EKG because her heart is racing. And there, and while she's, trying to give birth to her first child, she gets diagnosed with a potentially fatal heart condition. Again, that could have killed her. That they might have discovered, 3 months prior, but no one bothered to even, try to discover the source of her symptoms. The bouts of pain that she experienced, um, They continued after the birth of her child. She ended up in the ER probably like 6 weeks postpartum. Somebody finally ran a blood test, and the blood test revealed that she had pancreatitis. Her enzyme levels were so high that they were potential like they were on the edge of being fatal. So she had emergency surgery to remove her pancreas. Again, might have been diagnosed months prior if somebody had bothered to just do a simple blood test. So what Annette's story reveals to us is that all the class privilege in the world will not protect Black people from being dismissed, from having their symptoms ignored. It will not, in the class privilege will not inevitably lead to quality health care.
Yeah.
But one of the other interventions that I make in the book is to not just put the entirety of the problem on that interpersonal interaction that happens in the clinic. Instead, I think we should think about the structural causes of these pregnancy complications. And so I want to ask the question, like, what structural conditions might have led Annette and
Mm,
other Black people to be more predisposed to getting a heart condition that might be fatal?
yeah.
What sort of environments do we have to navigate as Black people in the US, that makes it so that we're more likely to develop pancreatitis, right? So it's a combination of like that interpersonal interaction in the clinic, where people dismiss our pain and don't take us seriously, combined with like the hostile environments that we have to navigate as people of color in the United States that just sicken us and predispose us to early death. It's a combination of those two things that leads us to have these higher rates of maternal mortality, even at the higher ends of the socioeconomic ladder.
As you're telling Annette's story, I can't help but I keep thinking about Alabama, and I keep
Hmm.
thinking
Hmm.
about how we have the third worst maternal mortality rate in the country, which puts us as one of the highest in the world,
Right.
and like this one state. So I'm gonna read a few stats to you because I
Okay.
have a point with this. 55 out of our 67 counties are rural.
Okay.
62% of this state lives in areas officially designated as healthcare shortage areas. So I hear about Annette, and I
Mhm.
think she had access to this premium hospital in San Francisco. 55 out of our 67 counties are rural. I'm thinking about the women who are pregnant who have to drive an hour and a half, 2 hours to their nearest hospital when pregnant. I'm thinking about them being dismissed and
Mhm.
having the long drive home. I'm thinking about them being dismissed and then an emergency happening and them not having even the ability to make it to a hospital.
Yes.
Like what does Annette's story reveal about the women who live in these rural places who might not even have access to a public hospital, let alone a private one?
Right. Absolutely. Yeah. So, to in a to a great degree, and that is privileged, because she lives in a space where she has access to a number of different healthcare
Yeah.
facilities. But the situation isn't, much more dire for those living in rural areas. And what you've described is absolutely spot on, where Whereas, Annette might have to drive 15 minutes to an emergency room. If you're living in a rural area, you're driving an hour, 2 hours to, some sort of healthcare facility. And so when you have an emergent condition, when you're having an emergency, it increases the stakes of provider negligence, right?
Yeah,
Like it's
yeah,
already bad when a provider ignores you and tells you that you're fine and just, go down to the Walmart and get a more supportive bra when you actually have pancreatitis. It's already bad. But when the stakes of being dismissed is a 2-hour drive home after you've already driven 2 hours to the hospital, it just increases the likelihood that you will die and that you'll have the statistics that Alabama has when it comes to maternal mortality and morbidity. And I'll also just mention that part of the function or part of the reason the U.S. has such high rates of maternal deaths across the board is that we are not adequately funding Medicaid.
yes,
And yeah,
yes,
and yeah, and so, part of, the Trump administration 2.0 was the passage of this horrible bill. And that horrible bill gutted Medicaid. And Medicaid reimburses at a fraction of the rates that commercial insurances reimburse. So whereas, if commercial insurance is reimbursing at, a dollar, Medicaid is giving 25 cents. And so what that means is that for facilities that primarily care for Medicaid insured people, they're receiving, again, a fraction of the revenue that these spaces that primarily care for commercially insured people receive. And so when it comes to maternal health specifically, maternal obstetrics clinics that care for Medicaid patients are operating in the red. They are not able to meet the cost of delivering healthcare because they have to rely on Medicaid. And so what that means is that a lot of them just close their doors. And so now we have maternity care deserts, even in urban areas. In DC, there's a maternity care desert because the obstetrics departments, the obstetrics clinics have closed because the Medicaid reimbursement is not enough to allow them to remain open and to care for people. So now people in DC are having to drive dozens and dozens of miles for healthcare. And so part of the solution to the maternal health crisis as a general matter in the US is for the government to actually fund healthcare, is for the government to actually fund Medicaid.
I'm so happy you brought that up because this is something that pisses me off beyond belief. I worked on a congressional campaign, a Democratic congressional campaign back in 2018. And in 2018, we saw rural hospitals closing and we saw the threat of closures at dozens more across the state of Alabama. Since 2018, I believe like 12 rural hospitals have closed because of the lack of funding and expansion of Medicaid and Medicare. So we know that the money is there. All they have to do is agree to use that funding to expand healthcare here in Alabama, and they won't do it. They just won't do it. For whatever reason, they won't do it. We know the science behind all of these maternal mortality. That is a tongue twister. Maternal mortality. I don't
Say
know how
that
you
5
do it.
times fast.
I can't. We know the science. We know the stats behind maternal mortality rates. We know what can close that gap. But yet they refuse to expand the funding that we need to keep these hospitals open. And in my mind, and I don't think it's extreme to say this, they are greenlighting the deaths of women. Like that death is a policy choice at this point.
Absolutely. And so it actually goes back to what we were talking about at the beginning of our conversation, where the GOP is so focused on trans people. They're so focused on keeping that one trans girl, out of women's sports. And they're so focused on Muslims and Sharia law, that they're distracting the electorate from the fact that their policy choice is to not fund Medicaid. They're distracting from the fact that this means that hospitals are going to close. This means that people who become pregnant, who desire, so we're not even talking about abortion, right? We're talking about people with like wanted pregnancies who want to bring babies into this world. The GOP is distracting from the fact that that is dangerous because of their policy choices,
Yeah.
that people don't have the health care that they need, that they might die from a perfectly preventable cause, that if they lived in Canada, if they lived in Belgium, if they lived in Sweden, it wouldn't be an issue. Like Sweden has managed to eliminate entirely the number of deaths from embolism. Just like, you develop a blood clot after a C-section, and we still have a significant number of deaths from embolism in the United States. Other countries have eliminated it entirely. And so like that is the policy choice that we're making. And that's the folks who we're voting for when you cast your vote for a conservative, for most of the time for a conservative candidate. They're distracting you with like trans people, while what's at stake is whether you will survive your
Yeah.
pregnancy.
One thing or two things that you talk about in your book, and these are not ideas that I agree with or support in any way, but they're I think two cop-outs that when you present these ideas of just maternal mortality to people, and you're talking about healthcare for your community, they will either say that the Black people are biologically predisposed to worse outcomes, or it's the diet, it's the culture, it's the choices. And you address those in the book. But to the people who, because I reach a wide variety of people on this podcast. And so if there is even one person who's listening to this conversation and their mind has even for like a second drifted to those two statements, what do you say to them?
Yeah, there's no evidence of it. There is absolutely no empirical evidence. So when it comes to genes, like genes is like the classic. I love the word. It's a classic cop out. The idea that Black people are more likely to die from a pregnancy-related cause, or more likely to have hypertension, heart disease, or kidney disease, or diabetes. All the things that kill Black folks at higher rates. That we're more likely to have that stuff because it's just Black genes. Like we have this race-specific genetic variation that predisposes us to all manner of death. And so there's just absolutely no empirical support for that. In fact, there is no empirical support for the idea that the groups that we think of as races, white, Black, Asian, Native, maybe Pacific Islander, throw that in. The groups that we think of as races, there's no empirical support for the idea that those reference genetically coherent populations of individuals. And so there is genetic variation amongst the, humanity, but you can't divide humanity into the 5 groups that we think of as races, and consider those groups to be, genetically homogenous. Instead, genetic variation is more like a spectrum based on geography. And I don't mention it in Expecting Inequity, but in some of my earlier writings, like Africa is like a stone's throw from Southern Europe. So the folks who occupy Northern Africa and Southern Europe are more genetically similar to one another than the folks who occupy Western Europe and Eastern Europe. But the North African folks are supposed to be Black and the Southern European folks are supposed to be white. Nevertheless, they are, more genetically similar to one another. Moreover, the Western Europeans and the Eastern Europeans are both supposed to be white, but they're more genetically dissimilar to one another than other populations. So the idea that there's just like some gene that's killing Black people, there's just no empirical support for that. And then the other cop out that you mentioned is culture, that Black people are more likely to die from all the things because, we eat fried foods and we eat high sugar diets and we have high fat diets and we don't exercise. And so all of the sort of public health research coming out, that tries to
Yeah.
address or that looks into the veracity of that claim, there's just no empirical support for it. When you control for diet, when you control for exercise, when you control for smoking and drinking and all of the things that might have deleterious effects on people, Black people still have elevated rates of death from hypertension and kidney disease and heart disease and all the things. So it is not, and then of course I problematize the concept of culture in and of itself. I want to know what Black culture is.
Yeah.
When people say, oh, the Black culture, I want to know what it is, and I want to know how people get it, because Black culture is supposed to be like fried chicken and watermelon and gospel music. And I don't participate in, except for the watermelon part. I do like a nice cold watermelon. But I am vegan. I exercise every single day. I actually exercise too much. And I don't listen to gospel music. So how did I come to be exempt from Black culture? And how come there's so many other people eating fried foods who are not Black? Are they participating in Black? Like, so it's just like this amorphous concept that does more harm than good when it's invoked in this particular context.
Yeah. And first off, thank you so much for addressing that. I know that's like an uncomfortable thing to like talk
Mhm.
about or to address to
Yeah.
some people who don't have open conversations like this. It might
Mhm.
be uncomfortable to hear at first, but I think it's so important to have this conversation to dispel any kind of thinking and to understand like why that's harmful and why it's wrong and why it's just flat out not true. And so I appreciate you talking about that with me. And there's some stuff that you talked about that I don't think it's Black community specific, but it's when you look at like play, and I often use Alabama because it's what I know, it's home and it's what I want to change. But when you look at places in Alabama and you look at what communities are marginalized and how they are marginalized and what that marginalization, I cannot speak today, what that looks like at the community level, you kind of get an idea for what they have access to. Is there public transportation? Can they make it to a grocery store across town? If they can't, then what do they have access to with the means that they have? And it's
Yeah.
again not specific to one group of people.
Right.
It's so bad. And then, but I look at certain nonprofits, like say the American Heart Association, they put a lot of money into research like food is medicine, understanding how food can bridge gaps with health disparities. But then it's not just like food is medicine. It's looking at where are the food deserts? Why do food
Yes.
deserts exist? How
Right.
do we bring in quality food to those areas? Because people clearly can't afford it and they can't access it. So how do we bridge
Absolutely.
that gap? So
Yeah.
anyways, what you were saying just made my mind go a bit deeper into like how there's such a problem with the marginalized communities across America and what they have access to, and then what that means for their health.
Right, absolutely. I give this example in other work that I've written about, like McDonald's has a dollar menu. Like it's literally the dollar menu. And like you can get some really terrible things when it comes to salt content and fat content and
Yeah.
sugar content from that dollar menu, but you will be sated, right? You will not be hungry. But again, that's the type of food that leads to all the things, hypertension and kidney disease and heart disease and so on. And so you can get a burger, some fries, a soda, uh, an ice cream or something, and then like, a sandwich for later for $5. Try to buy anything from Whole Foods for $5.
You can't.
I don't think they will let you in the door if you only have $5.
Yep.
You can't. I remember I was just went to Whole Foods the other day. I think Endive started Endive started at $6 at Whole Foods. So, right, the foods that are health conserving, the foods that are good for your cholesterol and your blood pressure, right? Those things are expensive,
Yeah.
number one, and number two, there's no Whole Foods in the hood, right? They don't have Whole Foods. They don't have grocery stores, right? In the food deserts that you mentioned. And so now, even if you were to find the $6 to get some endive for a salad, now you have to hop on a bus and go across town to buy fresh fruits and vegetables. And so it's such a cop out. Thank you for that. It's such a cop out to say that those communities that they just like the dollar menu, like that's part of their culture, that they just like the fry, like that's just a cultural particularity is the sugar and the fat and the salt. It's such a cop out to do that as opposed to explaining it in terms of
Yeah.
structural conditions.
Exactly. Exactly. And this kind of leads into the next part of the conversation that I want to discuss. Let's kind of get into the policy aspect to everything and the policy aspect of the maternal mortality crisis in America. I believe you said this in an interview recently. I've heard this from a few other people in interviews. Like we're at a moment where you can't even like use the word race in health policy. You can't use race. We know certain demographics across the US, they're dying at higher proportions, at higher rates. With what's being dismantled right now that we're seeing come from the Trump administration, what does all of this mean for the maternal mortality crisis moving forward?
Right. Well, it means it's going to get worse. That's the short answer. So a couple of years ago, the Momnibus Act was introduced into Congress. And the Momnibus is like this multi-part act that addresses various contributors to the maternal health crisis in the United States. Like, it mandates implicit bias trainings, for example, and it funds midwifery care and community-based solutions. And so it's a great piece of legislation. It didn't pass the first time that it was introduced. It was recently reintroduced. But the bill that was recently reintroduced makes no mention of race whatsoever. It's been scrubbed of any identification of Black people as dying at higher rates than their white counterparts. So it makes it seem like this is just a maternal health crisis in the US, which it is, but it obscures that those who are being felled much more frequently from the maternal health crisis in the United States are Black people particularly.
Mm-hmm.
And so it's trying to solve a problem that is racially salient, a problem that is exacerbated by racism through race neutral means. And I have never felt that one can solve racism by ignoring race. But that is and I was about to say that is what the Trump administration is asking us to do, but that's actually inaccurate because the Trump administration is not interested in maternal deaths at all. Part of its gutting of the administrative state that it began in 2025 was to dismantle all the parts of the CDC and all the parts of other administrative agencies that looked at maternal deaths in the United States. So they fired everybody. They got rid of those agencies. They got rid of those departments. So the Trump administration doesn't care that people are dying preventable deaths from pregnancy-related causes. And they certainly don't care that Black people are dying more frequently from those preventable deaths from pregnancy-related causes. Yeah. So the Trump administration is inviting us first to ignore that people are dying, and then like to doubly ignore that the people who are dying disproportionately are Black.
Yeah, I'm happy that you bring that up because the past 3 guests that I've had, it kind of all built up to what you just said. So I had a Dimitri Daskalakis that came on, and he was high up at the CDC, and he rang the bell, left the CDC when there was mass firings. He came on here and talked about the need for bureaucrats because it's such a negative word in today's society. But what that really means is there's institutional knowledge that that doesn't act on party lines. It acts on the best interest of people.
Yeah.
We had Cass Sunstein, the Obama advisor, who I was talking about earlier, who came on, and he was also talking about the gutting of all of these agencies, and what it means for Americans is that you're losing all of this historical knowledge, that they don't have these agencies that were doing good work working for the people anymore, and you can't just rehire these people. Like, it has to be rebuilt from the ground up, and you lose decades of progress that was made.
Mm-hmm.
And so now you're like closing the loop and tying it all together on what that means specifically for our healthcare. That is, I mean, it is mind blowing to me.
Yeah. And I would say it's like, to what benefit, right? Like, we dismantled these agencies, we fired all these people with institutional knowledge, with just like expertise. I mean, I think this, just as a general matter, like, our present political era is one of that denigrates intellect.
Yeah.
It denigrates science. It denigrates, expertise. There's no respect for people who have like deep knowledge about issues and things and phenomena. And so we have dismantled the administrative state, and we've fired these people from these agencies who were, first of all, just tracking the maternal health crisis, but then also had knowledge about what we can do to solve the maternal health crisis. We got rid of them. For what? What benefits have we experienced from all of that carnage?
Yeah, there's all that carnage, and it's not being tracked. So they're going to say, well, it was, I mean, I'm just pulling these numbers out of my ass, but like, they're going to say it was 60%, but now it's 0%. Well, it's not being tracked anymore because you fired everyone, and they're going to try to call that a win.
Right.
And the unfortunate thing is, people are going to believe it.
People are going to believe it until it happens to them. I
want to make a connection real quickly, because I think this is important to talk about the political moment that we're in. We talked a little bit about it with Trump in 2025 and the gutting of all these agencies, but more specifically, quite literally, the political moment within the past 24 hours. And that being the Supreme Court just gutting the Voting Rights Act. And we know what that is. It is true racism in like its purest form. They want to dilute the Black vote in places like Alabama. They want to get rid of districts that give people a voice that they otherwise would not have. That's all I'm going to say about that. But I want to bring up two points. We had a case that gutted the Voting Rights Act in 2013. It was Shelby County v. Holder. And within hours of that decision in 2013, states began implementing voter suppression laws, and it was allowed. Alabama drew redistricting maps that were designed to dilute that Black vote in districts like in Terry Sewell's district. They were trying to dilute that vote. The Black vote, it dropped 6 points, while the white vote only dropped 1 point. And I think within that voter, that drop in votes, I think shows the intention of what they were trying to do with that case. They succeeded at what they were wanting to do. We've talked about how the legislature has they have knowingly just decided, you know what, we're going to greenlight these deaths because we just don't care. It's not politically advantageous for us to expand Medicaid and Medicare and all of that stuff. I want to tie the maternal mortality crisis that we're seeing across the country and in places specifically like Alabama with the Voting Rights Act. Is it fair to say that those two things are inseparable? And if I'm wrong on that, say so. But in my mind, I'm thinking if they're diluting the vote of one group and it affects them more, and the issues affecting them, and they're not being answered, I would argue that they're inseparable.
Yes, absolutely. So I think everything goes back to voting. And in a country that purports to be a democracy, many of our most politically salient issues go back to voting. So thank you for mentioning Shelby County versus Holder. It's such an important, it's the beginning of the evisceration of the Voting Rights Act. Like people need to understand. Don't get me started, chat. Because people like to think of like this Supreme Court as like just like exceptionally bad. And it is, but it's just a continuation of
Yes.
like at least a generation of terrible Supreme Courts. um, like this is a very extreme iteration of a terrible Supreme Court, but they're just building on horrible precedent that was laid down years prior. Shelby County versus Holder, 2003. Am I right?
That one was 2013.
It was 2013. Okay,
Yep.
2013. So we're talking about at least a decade ago that the court began eviscerating the Voting Rights Act. And all of these techniques of voter suppression that we see with, these, just the purging of the voting rolls and the closure of polling places in communities of color, and these, strictures on who can get, can even cast a vote. All of those things flow from Shelby County versus Holder,
Mm-hmm.
because the Voting Rights Act specifically said in these counties that had demonstrated that they were trying to diminish Black voting power, that they had to get approval for changes to their voting laws from the feds, essentially, from a panel of federal judges. And so in Shelby County versus Holder, they gutted that portion of the Voting Rights Act. And they said, you know what, Alabama, y'all do what y'all want to do. Y'all can
Mm-hmm.
change your voting laws if you want to without this pre-clearance. And what we witnessed are the statistics that you mentioned, which is that we have a diminution in Black voting power by 6 points. And so we absolutely should tie that to the Black, maternal health crisis. We should also tie that to the hyper incarceration that we witness in the United States. We
And
also
don't get
should
me
tie
started
that
on
to
that one.
like we should tie it to all of these issues that are disproportionately affecting communities of color, because communities of color cannot make themselves known in the political sphere because they can't vote.
You have me
Because they're
you have me
go
rolling
on.
up my sleeves. You have me rolling up my sleeves because you're talking about this. We're talking about communities of color. We're talking about Shelby County v. Holder. And in Alabama, you have all of these political ads. You have all of these conversations about you have to have an ID to vote.
Right.
You need an ID. Well, no one wants to talk about how 10 years ago our Secretary of State closed DMVs in the most
Yes.
rural of counties. So
Mhm.
if you live in West Alabama that has no public transportation, they have no DMVs,
Mm.
very, very poor parts
Mhm.
of Alabama, these people have no way of getting to a DMV or a place where they can get a state issued ID.
Right. Yes. So, right. And so, and
Oh,
tie that to the fact that the hospitals are closing, and tie that to the fact that the healthcare infrastructure doesn't exist, right? So query whether these counties, in which people can't even get an ID, so they can't vote, like if the people could actually vote and they could elect into the halls of power people who represented their interests, whether they would be funding Medicaid at a quarter to commercial insurance's dollar, right? Whether they would decide to, I don't know, spend money on a ballroom as opposed to spending money on building health care institutions in
Yep.
rural areas, right? Query what the priorities of those jurisdictions would be if the people actually had voting power and the ability to be represented in the political sphere.
Yep. Yep. Yeah. I want to bring up California real quickly as we round out the episode, because in 2006, they launched a statewide program for maternal quality improvement. And
Mhm.
by all accounts, it was a success. They standardized hospital protocols around the leading causes of maternal death. In the 10 years after that program was implemented, they cut the mortality rate, the maternal mortality rate in that state from nearly 17% per 100,000 people down to 5.9. And that's my bad. It was 16, almost 17 deaths per 100,000 people down to about 6 deaths. So while the national rate climbed, that rate decreased in California because they put together this comprehensive plan. A lot of states, they don't have anything like that. No one's talking about it. They're not even, they don't even have like the seed of an idea to get it going. They're not even talking about it. So what
Right.
does building something like that in a place like Alabama, and which I would say is more on the extreme end,
Mm.
what does it take to start laying the foundation to do what California did 20 years ago?
Right. Yeah. Now, so when I say that the Black maternal health crisis can be solved, it's not because I believe in magic. It's not because I believe in fairies. It's because states have managed to reduce disparities. I wouldn't say eliminate it, but I would say reduce
Yeah.
disparities, and California absolutely is one. And so you mentioned protocols that
Mhm.
California has implemented, and we call these safety bundles. And basically, it's just best practices. And it um, clearly identifies the best practices for dealing with particular conditions. So if a pregnant person comes to the hospital and their blood pressure is 160 over 100, the safety bundle says, don't send them home. Do not send them home. Maybe admit them, give them some antihypertensive so that they don't go home and have a stroke and die. The safety bundle says somebody is experiencing bleeding after birth. Don't send them home. This is what you do, right? So it's essentially just tells providers what to do in the case of emergency situations. And as a result of implementing those safety bundles, that it helps to explain how California managed to reduce their rates of maternal deaths. Alabama absolutely could do the same thing. Like today, it absolutely could. And when you were talking, when you were posing the question, you were saying they don't, folks don't have a hint of an idea of how to even begin to do something about maternal deaths. All they have to do is look at California. Like they don't have to reinvent the wheel. All they have to do is be inspired,
Mm.
and say, we're gonna try that as well. Um, Other things involve money. And politicians will be the first to tell you, we don't have the money for that. We don't, because, part
Yeah, they do.
of and that's exactly how I respond. Part of the reason California was able to reduce its rates of maternal deaths is that it started funding programs. So, Medicaid is now extends. It used to the Medicaid eligibility would stop 8 weeks postpartum. In fact, a lot of complications that lead to death develop after the 8 week postpartum period. And so California said, all right, let's extend Medicaid eligibility for a year postpartum. And so that allows people who have, conditions that their
Mhm.
pregnancy might have induced, it allowed those people to continue to get health care for the year so that those complications can be resolved so that they don't die. So spend a little bit of money, allow
Yep.
folks to get health care for an entire year postpartum, and you'll realize reductions in your maternal death rate. Also, doulas. Doulas have been for the uninitiated, doulas are not healthcare professionals. Instead, they're like just advocates. They are there to help the pregnant person during their pregnancy and certainly during their childbirth, during their labor, to make sure that they are cared for, that they have the things that they need, that they have an advocate in the room for them, when the pregnant person is at their most vulnerable. California now funds doulas through its Medicaid program. So now you don't have to pay out of pocket for doula care in California. If you are on Medicaid, you can just rely on your insurance. And doulas have been demonstrated, again, reams of research at this point, reduce the rates of C-section, reduces the rates of pregnancy complications, increases the rates of breastfeeding postpartum, which has, lots of research shows
Yeah.
that is best for infants. So again, we know, like, it's kind of like the low-hanging fruit. Like, just pluck the low-hanging fruit. It's right there. But like I said, like, Alabama lacks the political will to do. Alabama is willing to just put his hand in the sand, head in the sand like an ostrich, and pretend it's not happening. When it looks up and looks around at people dying, it'll start saying stuff like, it's the genes, it's that fried chicken, it's because pregnant folks are riding around in cars without seat belts. Like, literally, that is what maternal mortality review commissions have identified as, like, the problems of maternal deaths: seat belts and smoke detectors in houses, as opposed to, are you funding healthcare? Do people have hospitals to go to? When they go to the hospital, will you send them home when they are having a hypertensive episode? Right. And so instead of doing that, Alabama's just going to pretend it's not happening.
You know what you're saying, and this is the second to last question, with the last one being, what are you not wrong about?
Yeah.
You say that, and I'm like, the target audience for that messaging is Tommy Tuberville in my
Yeah.
mind. And I obviously did not vote for Tommy Tuberville, but I apologize to everyone for Alabama creating him. And so I apologize
You don't
sincerely.
have to take responsibility now. It's not, this is not on you, Chet.
But oh my gosh, but I can't help but be sorry for the hell that has been unleashed on this country because of him. But with that being said, he made a statement yesterday where he was saying, you know what, just like buckle up, just
Mm,
shut up, give
mm.
Trump his last 2 years, let him do what he was elected to do, and then in the next election, if you want someone else, just go vote for them. And I'm like, what a privileged statement that is.
Mhm.
Number one, that is the most privileged shit I've heard in a long time.
Mhm,
Um,
mhm, mhm.
and that's saying something. But like, truly, like, in the environment that I find myself in this state, that is saying something. But there's so many women, so many
Mm,
people of
Darn.
color who are pregnant right now who can't wait for the next administration. They can't even wait till the next the midterms in
Right.
November.
Absolutely.
To
Absolutely.
those people, what do we say to them? To the ones who can't wait for the next election, the next administration to create change, if they're willing to do so?
Yeah, I know. It's such a tough question because and I get it often, because what I describe in the book, are these, like, huge sort of structural issues that require, like, political action
Yeah.
to solve. But, like, we are in the here and now and today, and there are people who want to be pregnant or who are pregnant, and they ask me whenever I talk about this book, like, okay, so what do I do? And so I give them strategies. I'm like, okay, find a doula, if you're Black. I talk about it in the book. Black providers have been demonstrated to improve the health outcomes of their Black patients. So, consider hiring a Black obstetrician or a Black midwife
Hmm.
if you can. Community is important. So I give them strategies for navigating our present. But it's so unfair. It's so unfair to ask people to solve a structural problem for themselves.
Yeah.
It's so unfair to say, see if you can gather together $500 to hire a doula to be present at your childbirth, at your labor, when, like, we did not create, like, the pregnant person did not create this problem.
Hmm.
They didn't, a Black person did not create the anti-Blackness that makes navigating the US such a toxic experience. But when Alabama refuses to do anything, when the federal government refuses to do anything, and Texas refuses to do anything, we are leaving it to individuals to like, buy yourself out of this problem. and what a capitalist like solution, right? Where we imagine that the solution is in the market and that you can buy the goods and services that you need to survive like a basic physiological process, which is pregnancy and
Yeah.
childbirth.
Yeah.
Um, it is incredibly unfair. We also should be embarrassed as one of the wealthiest nations in the world that that is the solution that we're proposing to people, that as one of the most, again, powerful governments, powerful nations, like in the world today, that we say, see if you can find a black midwife. That might help. It may or may not, but see, like it's like we are abdicating our responsibilities, leaving it to individuals. And like I said, I think we need to bring shame back. We absolutely need to bring shame back. We should be ashamed of what we're doing in the United States on a couple of different, measures and a couple of different contexts, but certainly when we're talking about maternal health.
Not only shame, and you don't have to endorse or agree with what I'm about to say, but we also need to bring bullying back. Like, please let me, please let me go bully the people who are keeping this issue prevalent, right? Like, who are
Yeah.
perpetuating this for for longer than it needs to be a problem. Like, let me go bully them a little bit and actually make change that way. Anyways,
Yeah.
I don't agree with bullying,
I
but
won't,
in
I
this
won't,
case,
I won't endorse it. I won't endorse that publicly.
but with some representatives, they need it. So let me just say that, Khiara, we've made it to the final question. So I and my audience, we want to know, what is it that you are not wrong about?
This is an argument that I have with my husband from time to time, and I am not wrong that reality TV is a delight.
Oh, hell
And
yes.
and I'm talking about like terrible reality TV, like not the highbrow stuff. I'm talking about Love is, you know what? Love is Blind is not terrible. Love is Blind is quality. But like, Selling Sunset, and Owning
Yes.
Manhattan. Oh my God. And I
Oh,
and I'm also a big like love and hip hop and like I'm that type of girly. That stuff is a delight. It's good to turn your brains off and watch people make a mockery
I
of situations through alcohol fueled confrontations. It's a delight.
I love reality TV, whether it's the overly produced reality
Yes,
TV or I believe Owning Manhattan. Isn't that Sauron?
it is.
That it is so bad, but it is so good.
So good, Ryan Serhant. Yes, you just be animated in every single situation that you're in, and I'm gonna gobble it up. I love
Like
it.
like the shower scenes, like when he's like getting ready just to go into work, and they're like close up, like lathering his arms and like putting on
Yes,
his suit.
and
Like
it's foggy
what?
just from like the chest down. It's foggy because we can't see that, but if we can see that chest, we know he doesn't skip chest day.
I can 100% say you are not wrong about that.
Thank
You are
you.
not
Thank
wrong.
you.
You're
Thanks
welcome.
for agreeing with me.
Listen, I am so grateful for your time today. I know we went well over the scheduled time that we had, and I'm so grateful for that and appreciative that you have joined us today for the work that you're doing, the fight that you're putting up, the fight that you're continuing to pursue. I am so, so grateful for everything that you shared with us. This conversation truly was captivating. I'm not done listening to your book yet. I'm close to it. And I'm like about to hang up here and I'm going to go finish it. I'm like, let's get going. I want change
Thank
has to
you.
happen. And it starts with people like you and the books that you write, the information that you share, and the people that you empower. So thank you, thank you, thank you from the bottom of my heart for everything that you do.
Thank you, Chad. Thanks for creating such an amazing platform for these types of conversations. As you mentioned earlier, people aren't talking about this stuff enough. So thank you for talking about it in this space.
Absolutely. We'll be talking soon.
Thank you, Chad.